Hello, everybody. My name's Allie, and today we're going to be talking about the recurring fevers abroad, a case of intermittent malaria in a global executive. So, a little summary about my case study. I have a 60-year-old international telecommunications executive who visits the office and complains of a high fever. Now, the fever is not constant, but it's intermittent. When you press him for some details, he estimates that about every 3 days or so, he suffers these debilitating sweats. He usually has headaches and muscle aches during these episodes that keep him home from work. Now, after about half a day or so, he feels better, and he reports that he is experiencing these episodes for an ongoing of 2 months now. So, what is the name of the suspected bacteria? Well, the bacteria of this patient is malaria. The scientific name for malaria is Plasmodium species. The pathogen is a protozoan parasite, and its classification is an ampicomplexan or a non-motile protozoan. Now, the physical description is that they are unicellular, a sporozoite during the infection stage that is typically slender or crescent-shaped, that lack cilia or flagella, and are intercellular parasites that invade red blood cells and liver cells. The intermittent fever is about every 2 to 3 days with chills and sweating, which is commonly known as a malaria paroxysms, that is classic for malaria. Now, the patterns of the fever corresponds to the life cycle of the parasite invading the red blood cells. Now, some of its special structures include the apical complex, which is specialized structure that is used to invade the host cells, which is key to penetrating the said before red blood cells and liver cells. Then it kind of progresses on into the merozoites, which produce during the replication in the liver that invade the red blood cells, and then the hemozoin pigment, which is a waste product formed from digesting hemoglobin that contributes to the immune response and symptoms. Then there's the antigenic variation that alters the surface proteins that invade the immune detection, and then the last being the intracellular life cycle that protects the parasite from host immune systems. Um, on top of that, you can have the major sign and symptoms. For malaria, it's typically often like a flu-like symptom. So there's the typical fever that is often cyclic with the chills and sweats. That's around typically 2 to 3 days. And then it can persist on with headache, fatigue, muscle and joint aches, nausea and vomiting, anemia, and even jaundice. So what should you first question the patient's history about? Um, some of the questions that we might ask is, have you recently traveled to or lived in any areas that are malaria epidemic areas? Since malaria is transmitted by the Anopheles mosquito, asking questions about traveling in regions such as sub-Saharan Africa, parts of Asia, South America, and even in other endemic areas is highly, highly crucial. Other relevant questions that we may include would be asking the history of mosquito bites, use of malaria prophylaxis, or previous history with malaria, and any blood transfusions. So, which is the most dangerous of the species that can cause this disease? The most dangerous is the Plasmodium falciparum. It is the most severe of the malaria that can lead to cerebral malaria, causing seizures, coma, and even death. It can also cause high levels of parasitemia because it infects the red blood cells of all stages and ages. It can lead to complications such as severe anemia, kidney failure, and even respiratory distress, and is responsible for the malaria's related worldwide deaths. And you can kind of see here on the right, this image, how it kind of starts as a typical normal red blood cell, and as later as the maturation forms and it grows into its adult stage era, you can kind of see how eventually it leads into this female male cell that basically cuts the original circle literally in half. And as we all know, that some of red blood cells are important to carrying our oxygen throughout the body. Now, the last question that we would have are what are the two main places in the human body that are exploited by the causative organism of this disease? Well, the two main places, as we kind of discussed before, are the liver and red blood cells. Liver cells are also known as hepatocyte, hepatocytes. The sporocyte from the mosquito bite will invade the liver cells first, where they will first mature and then multiply. And then later on, after the maturation, they'll kind of attack the red blood cells, or they're also known as erythrocytes. And it'll kind of be the merocytes that enter into the bloodstream and invade the red blood cells, where they multiply. They'll eventually even rupture the cells, with and cause the characteristic cycles of our those fevers and chills. So, how do we combat and treat this sort of disease? Well, hopefully that within the treatment, it will hopefully begin within the 24 hours of the exposure to the disease, which is best to kind of combat it. But the cornerstone of treatment for the uncomplicated malaria, especially to the Plasmodium falciparum, is the artemisinin-based combination therapy, or ACT, which is a pairing an artemisinin derivative with a partner drug to ensure rapid clearance and hopefully reduce risk to resistance. And that is it. Here are my references for my case study. Thank you all again for listening. Have a good day.